Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today in my Health Conditions 101 series, we're going to be talking about COPD, chronic obstructive pulmonary disease. Please note, COPD is also known as COAD, or chronic obstructive airway disease, but I'm used to saying COPD, so we're going to stick with that during this video. COPD is a progressive disease of the airways affecting the smaller airways or the bronchi. It is actually an umbrella term for three underlying diseases: chronic bronchitis, emphysema, and asthma. The progressive narrowing of the bronchi or the airways can be influenced by three main things: smoking, the environment, and your genetics. When it comes to smoking, we're interested in not only your current smoking status, but your previous smoking status and your previous or current exposure to smoking, such as secondhand or passive smoking. As for the environment, the things we're looking at are: do you work or live in an area with lots of dust, pollens, pollutions, gases, chemicals, or smokes, which are all irritants to the lungs? And finally, a small proportion of people with COPD have a history themselves or a family history of a disease known as alpha-1 antitrypsin deficiency. Essentially, they lack the ability to produce the alpha-1 antitrypsin protein, which is very protective for the bronchi and the airways. As I alluded to, there are three types of COPD, or three subtypes of COPD. Emphysema, which is known as the pink puffer disease, in which air gets trapped within the lungs, which can make it hard to breathe in again because there's already air in the lungs. Number two is chronic bronchitis, also known as the blue bloater part of the disease, where there is constant long-term irritation of the airways with inflammation and increased mucus production. And three, chronic asthma, where there are narrowed airways which are not always reversed by medications. So what are the symptoms of COPD? They vary depending on you, how long you've had it or how long you've been developing it, if you're on medications for any of them. However, common symptoms include a chronic cough, which may or may not be productive, which often is productive in the morning, feeling breathless, having a reduced exercise tolerance or capacity, feeling lethargic and tired, having an increased number of chest infections a year, and finally, sometimes just having a chest infection that just doesn't go away, so protracted disease. Investigating COPD includes taking a good history, as always. It may include taking an X-ray of the chest to ensure we're not missing something underlying, such as a pneumonia or some sort of mass within the chest. And there are some very specific signs on X-ray that indicate COPD, including how much you can expand your chest and what the airways look like on X-ray. Lung function tests are the mainstay for diagnosis, so we look at how much you can breathe in and how much you can breathe out, both in total and in a certain time capacity, as this is reduced in COPD. We may even do a CT of the chest, especially if we're suspicious that something else may be going on. As for treatments, similar to asthma, you've got both relievers and preventers of current disease. Relievers include bronchodilators like salbutamol, which can open up the airways temporarily to relieve symptoms, and these are taken on an as-needed basis. As for your preventers, there are a couple of different subtypes, including long-acting bronchodilators, so longer-acting versions of Ventolin, inhaled corticosteroids, and something called LAMAs, long-acting muscarinic antagonists. These all act in various ways to relax the muscles of the airways or reduce the inflammation in the airways to allow improved airflow. These are taken daily. Of course, we also need to look at lifestyle factors such as ceasing smoking if you're currently smoking, which can be done with therapy, nicotine replacement therapy, and some medications such as Champix and Zyban. Of course, we're not just treating the COPD, we're also treating you as a whole person. So those with any chronic medical conditions are advised to stick to having a nutritious diet full of fruits, vegetables, whole grains, sources of protein. We encourage physical activity, which can increase your cardiovascular fitness, which can improve the amount of air that you can get in and your respiratory efforts, reducing your lethargy, reducing stress, improving sleep's also very important, and generally making sure that all your other screening is up to date. COPD is not just managed by GPs and respiratory physicians. We also refer sometimes, for a lot of patients, to pulmonary rehabilitation, which usually includes a physiotherapist to do chest physiotherapy on, which again can improve the symptoms that you're having with your COPD. We may also refer you to an exercise physiologist to discuss the types of exercises you can do, and a dietitian to help with all the nutrition stuff I mentioned before. The treatment of COPD also includes discussions about vaccinations to prevent infections, because with COPD, the ability to fight off infections that are respiratory, so flus, colds, COVID, is significantly compromised. So vaccination and prevention is better than any cure. Especially in the later stages, oxygen is sometimes discussed as well, because if you are not breathing well and the airways are damaged, you will not be absorbing enough oxygen to support general function. That being said, if you are currently a smoker, an oxygen, or at least at-home oxygen therapy, is not viable for you because of the risk of explosions. So going back to smoking cessation, really, really important. But oxygen therapy is not always needed for everyone. And there you have it, guys. COPD 101, the basics. If you have any questions, let me know. Don't forget to like if you learnt anything from this video, comment what you want to see next, and subscribe if you haven't already. I hope you're all having a wonderful week, and until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.